Okay.
Oh,
Hello, Ravi, my friend. Welcome back. Man, you are a encyclopedia of knowledge and medicine. I could give you some more problems to solve, and I think you'll solve them before you get up from this chair. But let me go into a lighter aspect of life and share some memories. So my first question to my guests are: if you did not make it to a medical school or you did not become a physician, what do you see yourself as doing that you would enjoy?
oh, that I would enjoy
Yeah.
serving people. I think that I had two aspects that made me a medical doctor, and I think and one thing is persistence that I learned from my father, with whom I grew up, who brought me up, and my own father, who is uh, who is kind of into service, is into politics and all that back home, and my mother, who wanted me to go into medicine. So maybe if she did not push me into medical side, I mean, she did not push me literally, but she kind of
Gave you the
nudged me.
direction. Yeah,
Yeah,
nudged you.
nudged me.
Yeah.
And if she did not show me my uncle as a role model, who's an orthopedic surgeon back in India, he's still, I think, 75 or so, is still practicing. And is if I did not have that role model, and if she did not push me, maybe I would have been a politician. But then I don't know what kind would I been. Maybe a rowdy cheater or something. I don't know. But
You want to
that
help
makes me,
people. Yeah.
yeah, no,
Public
help people.
service
A
is your passion.
public service. And but then I think I still have that in me, and that is the bend. I mean, like, I'm just taking knowledge and adding public service right now. That's where I am in. I mean, like, this public service is more of a focused public service,
Yeah.
and I think this would make a lot of difference than if I've been a politician.
Well, I agree with you that it's one of the noblest profession in the world that gives a lot of gratitude. So, would you recommend your loved ones in your life who come for advice to become physicians or come in healthcare industry?
Well, I have two children, and
Okay.
one of them, I just decided out of the blue, because of my India project of what I'm doing. I just pulled him out of here, my son, and I put him in India. That's how serious I am with my India project.
Yeah.
So I kind of moved my son from US to India to make him join a med school in India, so that once I get a semblance of my project, hopefully he'll be able to help me
Prodigy.
execute it. So
Amazing.
that's how
That's a
serious I am
level of
about it.
devotion you have.
That's a level
Uh,
of devotion, but I did not push him to do that.
yeah.
So basically, I told him, it's open. It's not going to be fun. You're not going to make money. If you want to make money to get into medicine, I guess that's not. I mean, it's no more that.
It's no more that.
It's no
True.
more that. But then, if you go into medicine, if you think about it, and then go figure out and solve a problem, maybe at the end of your career you will make a buck or two.
I think that most people can realize that two doctors talking about their profession is not because of the money, but the words that you say are the words that written here. It's the service.
Mhm.
It is only for service that you should be becoming doctors now. So thank you for sharing your vision, your thought, and make best wishes for your son's education and
And my
success.
daughter is a is a neuroscience doing neuroscience in Michigan State. So basically, I did not push them, but I guess they want to do it.
It's in your genes, it's in your genetics, your mom, dad, parents,
I don't
public
know about
service.
genetics, but I think it's priming the genetics. I should say
Yeah,
the
that's a
epigenetics.
good way. Yeah, that's a better word. Let me ask you a favorite destination of travel vacation that you want to go back in a heartbeat.
Oh,
uh,
India,
India,
India.
where in
I
India?
was just I take a
What,
flight and just go.
where would you go? What's your favorite spot in India?
No, I just go back home.
Yeah.
Just go back and be with my father, and then after a day or two, then I'm just packing my bags and running around the country.
And
I have
traveling.
friends all over. I
Yeah.
have friends all over from Madras to Punjab to Delhi and everywhere, Lucknow,
And
Mysore, Bangalore, Bombay. I've like I have like 3,000 friends.
yeah, I can see you are, and you're keeping up with a lot of them. When you travel, how do you travel usually there? Do you take a
Fly.
like a
I
drive,
fly.
a car, or fly?
I fly. I mean, like I would advise not driving in India.
Yeah.
So
And are is there any specific areas of India
I
that
mean,
you have been
India is beautiful. India is
yeah,
incredible, and India has its own thing, and I want to visit a lot of places. I talk about these things. Whenever I go to India with my family, I mean, like I'm trying to balance both. You see,
yeah,
and it just comes down. People talk about work-life balance. For me, it's more of a work-life integration. I really don't look at it like balance. I mean, that is crazy. That's how I am. But I look at it like I'm kind of running between things and just taking care of things and trying to weave my social life and also professional life. And then I hope whenever I want to go and see this and that. But sometimes it doesn't happen. But then I get satisfied with what I taught people, what I learned from them too, by the way, and learn their difficulties, learn their problems, and then come back and figure out how to fix it. And that is the beauty of what I'm trying to do. And at the end of the day, I have to be happy with what I do. And I
yeah.
don't really mind if I close my eyes, I can dream my way away to any beautiful place in the world. It doesn't really matter to me. Traveling, going and seeing something and doing something. It's a moot point for me. I mean, like I've zoned out completely from this kind of running this thing. I mean, like if I'm able to learn one small nook, some point, like say in Twitter world this morning, I learned something amazing that kind of made my day. I mean, like I said, I woke up, I was just, doing my brushing and just going through Twitter. Oh, there is a paper there. And then that makes me excited. I said, oh, there is like in rat, they did this diet and they released this thing. This beta hydroxybutyrate got released in rat by ketogenic diet or this thing. And there is increase of gamma delta T cells if you do eat this kind of lifestyle. And gamma delta T cells help our innate and adaptive system communicate better. Now, I take that idea and boom, right? I wrote that opinion piece. I mean, I don't think anybody wrote that. And the idea is all I'm doing is communicating one thing to another. You see, I'm communicating an idea that, you have a nutrition, which I understand. You have an infection, which I understand. And people don't think that nutrition impacts lipid system, nutrition impacts immune system. And I am trying to force that dialogue.
Yeah. So, what is, you just briefly mentioned something about your your ability to take your mind into peaceful moments of. So, my question was, what is and how you go into your moments of om? Do you meditate, yoga? Do you do something for your?
I did during, after my medicine, I did something called as SSY, Siddha Samadhi Yoga, where it's nothing but, meditation. But I mean, like I kind of have fallen off the wagon. That was like in 95 and never got on it yet. But what I what I've seen is I live in the now. So I'm talking to
Power
Tahir
of
right now.
now, huh? Yeah,
Yeah, I'm talking to Tahir right now. And I don't give a rat's ass about what's going on. It
that's
doesn't
beautiful.
matter.
That's
It
beautiful.
doesn't
That's
matter. I mean, like what I've done yesterday doesn't matter. What's going to happen tomorrow doesn't matter.
yeah,
It's going to happen. What's going to happen is going to happen. And what will happen will not change. But what you can do best to prevent whatever you don't like happening is to do something now like I said earlier, knowledge is illusion of power. I could be a doctor, but if I don't take action to fix my health, how can I fix our other person? So when I say that, I also knowledgeably acknowledge that I should exercise more. I should do a little bit of different things. But one thing I have to do is I sleep better. I have to do this. But then once I go to sleep, I'm gone like
Yeah,
that. So I get my 6 to 7 hours and I'm
that
back and I'm
that refreshes
trying
you.
to trying to do things.
So is there a childhood memory? Is it a school memory that you think about it and it brings smiles on your face? Is there anything that
Yeah.
you want to share?
Um, um, uh, I think there was a movie during my medical college. So no, during my childhood, and there was a there. It's called Shan. I think it's a Hindi movie.
I've seen it, Shan.
You've seen it,
Where's
and
there was Amitabh Bachchan,
yeah, Amitabh Bachchan, and there was another
Amjad
guy
Khan, Amjad Khan, I think.
yeah, but there was a guy who was a villain in that. His name was Shakal.
Yeah, Chakal. Yeah, yeah. Who used to have sharks?
Yeah, so
Yeah,
and
yeah,
then and that makes me laugh because you see every summer when I went back home to India, I mean I had full hair and all that. I still have it, but there's all grayed out. So this looks better on me, so I shave it. And
yeah.
then and the question is, I used to shave. I mean, like I go to a temple where I go and offer my like
Prayers.
hair and
Yeah.
penance, whatever I do. And I mean, that's a ritual that I do to this day. Whenever I go to India, I go to my temple that I believe in my Lord. And then basically people were teasing me, kids tease and give you a name. So that's something that
That's
makes me
what
laugh
that reminds you
whenever
laugh
whenever
because
I whenever I think about it. But then there is other things, It's like many memories of my place back, and I still have friends in contact, and I visit them when I go, and you
you
know,
bring back that memories and that
yeah,
time to.
we meet them in Hyderabad, in Andhra Pradesh, and Telangana area.
So you're a fan of cricket? You played cricket at
Yeah,
least.
I used to play. See, like I said earlier, I love playing cricket, and literally it gives me a high when I play cricket.
Hmm.
I mean, like it gives me a real high. I mean, like I get involved in it. But the moment I decided that I'm kind of coming to America, and I just said, what the hell will I be by being a cricketer? So cricket is not played anywhere there, and I did not know they still play cricket here. And the idea is, you need to focus on something. I cannot dabble around. I cannot be running around. And medicine, I picked up. See, you have to pick your battles,
Yeah,
and
you
my
picked
battle
medicine.
was medicine. So I mean, like in fact, to tell you the truth, I am enjoying medicine now more than ever. Literally, I mean, like it makes me happy now. I mean, like my medical college, I was not happy. I was a class representative for the class. I mean, like 125 of my classmates. I helped them. I did different things. But I mean, like I enjoyed it. But did I really enjoy it? Did I kind of be happy? I don't know. I don't even remember. But
Yeah,
now I feel that the more you're learning, I mean, like this is the flavor of medicine. You like, when you cook something, you get a nice flavor,
yeah.
and that is what I'm seeing. I'm seeing the change. I'm seeing what every day we are doing in healthcare, how we are changing with telemedicine, how this COVID-MD came out of Fruit Street, and how I'm trying to be that connecting piece, that cement in between this. I bring this solution, and I bring in, like I was the guy who brought in different other solutions into this thing, and I'm trying to add to the team. And
I
and
think your contributions are much appreciated, and I think at the end it would come out to be a product which will stand the test of time and also appreciation. So thank you for giving that time and effort. My question to you is that have you ever thought of a month of unlimited vacation where you have no worries of money again and
oh,
and time? How would you spend that 1 month?
I will just drop everything and go to India.
Yeah.
And
And
then
just be,
I'll take my app. I'll just I'll just go to every freaking village that is there, bring them together, give them free, give them the app free, because cost is not my issue anymore. You
yeah,
took care of my cost. Why are you only giving me a one month without cost? Why can't you give it for life?
for life. Yeah. That, I think we can change. If we give it to somebody, it should be you who could solve some problems.
Yeah.
Is there a digital health innovator or role model that you want to use his expertise, or maybe meet him and dig his brain?
See, nobody knows more than what you know, and nobody. Also, you don't know what the other person knows. Okay.
Yep.
So I come from an understanding that what I know, and I teach that person, and what I don't know, I learn from that person. So every person that comes across me, including my family, including my teachers, the nutrition field that I have kind of learned is from multiple teachers. I can start naming. There's around 40 people that I learned nutrition. So if you're talking about digital health, yeah, there is many names that you could take, but what does it really matter at the end of the day?
Hmm.
What is that? What is the what is it making? My knowing somebody is not going to make any difference, is it? I don't think so. It might give me a moment of a selfie with them. A nice selfie with somebody big would help. But the question is, it really doesn't matter if I'm not able to use that person's knowledge to effectively help another person. So, and that's why I love all these big people who talk big things and who are doing big things and who are using their money for many purposes. But it doesn't really. I really don't care. The real thing I care is how my team of entrepreneurs, how my team is executing a problem and learning every day and get excited about every nuance of what they are learning. If my team executes and fails, I'll push myself to go and lift them and kind of pat on their back and see if I can go broke and support them. I'm committed to to that extent. And that's where more than anything else, I think I like Fruit Street team. And in fact, my friend who is also a cardiologist in Houston, Dr. Asif Ali, and Lawrence Gerard, who's the CEO of Fruit Street. And there is a lot of members in the Fruit Street team that kind of have come to this whole process in an altruistic manner. But also, I do understand that cost is a factor, you know, and nobody's going to pay me money just because I go and take a selfie with them. The question is, I need to execute. I am the responsible person. I have taken the burden of solving this healthcare problem. It's not your problem. It's not anybody's problem. It's my problem. So that's ownership. That is the ownership level that I've taken on this. So, I mean,
So
like,
I've to say that, to conclude what you are saying is, I recently read in a book, and they call APR, which is not the APR we think of, but the absolute personal responsibility. And that's what you're
mhm.
taking, that, meeting Bill Gates is not going to make a difference until you are making yourself responsible to produce the results and take your cause further.
Yeah.
My one more question I want to conclude our talk with is, since you are more passionate about helping others and in this cause, what do you see our country's solution out of COVID-19 right now? What do you think? How can we solve this problem?
Solution is not that hard, to tell you the truth. If innovation is given a chance,
Hmm.
you give me 3 weeks, I'll take care of it.
Okay. So walk
I mean,
us through that.
how am I going to do it?
Mhm.
So I'm going to just open up this tool and have everybody download and also give them authority over it, okay? And teach them how to help themselves. And there is a study that was done, I think, from California. One of an amazing guy that did a study on pediatrics, where he showed that if you take off fructose from your diet, and if you don't even lose weight, just avoid fructose. And ideally, I would say avoid glucose too. But he wanted to prove that fructose was causing the problem. The major healthcare crisis in this country is not COVID. It is not COVID at all. There is like a silent tsunami of metabolic mayhem, of metabolic syndrome, and nobody is really detecting it. Nobody is even understanding it. That's the problem. You see, the data is not collected. So we collect vitals, we collect heart rate, blood pressure, respiratory rate, and there that goes, and maybe some weight. Nobody, number one, calculates BMI, which is not really the criteria. If you take metabolic syndrome, it's 5 criteria.
Mhm.
Waist circumference, okay, then uh, the HDL less than 40 in males and less than 50 in females, and then uh, triglycerides more than 150, and what is the fifth one? There like pulse rate, like I think it's I'm forgetting, it'll come. But the question is, of these 5 criteria, if 3 are positive, okay, so, and if blood pressure, sorry, blood pressure,
Blood
the
pressure.
other one was
Okay.
blood pressure. So
Mhm.
if 3 of them are positive, they call it metabolic syndrome. Now, the whole problem with metabolic syndrome is we have these 5 criteria. So we did not really understand that these 5 criteria have a common root cause. It's like a tree, you see? A tree has roots and a trunk and these branches. The branches of healthcare of cardiology, neurology, nephrology, urology, rheumatology, infectious disease, and all this. So everybody is treating the tree. I go and take care of that branch of infectious disease. You take care of rheumatology. A cardiologist take care of cardiology. But nobody's taking care of the trunk. The
Yeah.
trunk, the problem is something called as insulin resistance and leptin resistance. And that is the root cause of these 5 conditions of metabolic syndrome. And now, if it's like the healthcare system is trying to find its key where the light is, not where it lost it.
Hmm.
And the problem is that the people in charge are not guided right, and they don't know right. See, a politician is a politician is a politician, and a healthcare guy is a healthcare guy. And understanding healthcare from a vaccine standpoint is amazing. Understanding, having helped different things, but then question just comes down to, see, it's like we are trying to be an ostrich with head in the sand. We are not understanding that the solution is in us human beings, and not the bug of the day. We have survived and evolved after, not out of the blue. We have happened as human beings because of whatever happened. Maybe you call it divine intervention, maybe you call it something, but something made us survive. And the problem is we have grown in numbers, and we are the most susceptible population for infection. Human beings are the most susceptible population for problems.
Yeah.
And the issue is we have grown so much in numbers, and we have survived because we have developed a vaccine for measles. We have vaccine. So don't get me wrong. I like vaccines. But when it comes to a solution, why not like optimize the immune system? Why not tell a person, hey, it doesn't cost you a thing. Just measure your waist circumference to a height ratio, and it has to be 0.5 or less. That's all. We don't need anything else. Forget about all this metabolic syndrome or everything else. Just one criteria. Your waist circumference has to be half or less of your height. End of story. So right around the umbilicus divided by your height, 0.5 or more. So if you are not that, then you ought to figure out what is your problem. And that is your problem. So what has happened is we have in healthcare taken that onus on us as doctors. I mean, like, come on, what am I? Am I in your bedroom every day to see what you're doing? Or am I in your kitchen to see what you're eating? No. So you need to empower each person with the knowledge and be there. So the tool that I want to propose is engagement using cognitive behavioral therapy with the patient and empowering them with a tool that teaches them their change in healthcare and teaches them simple processes wherein they can measure their fat mass and then reduce and become a fat burning animal that we are born to be, and not a fat storing animal by carb loading on all the things that end up causing changes in the immune system, changes in your lipid system, affecting your genes, and basically causing trouble.
This is astonishing information that you are providing, and I'm surprised that you have created solutions to the problems to that accuracy there. What I wanted to ask you, a question that I've not been able to understand so far: why COVID infection is so prevalent in United States when the diabetes and metabolic syndrome is also high in other parts of the world? Why us more?
So, see, the issue just comes down to um, multifactorial problems. Okay, so number one, the major thing is testing. The second thing also is availability of healthcare and availability of recording of outcomes. If you don't track, you don't treat. I mean, like in situations of healthcare paucity where there is not much solution available, they are not going to track. And if you see the data delivery service, I mean, like when I go and try to say lecture on wound care in India, I ask for wound care data in India. It's not easily gotten. Whereas then I had to use this data and get whatever the meager data that I can get, then try to come up with conclusion. Now, we get this flu season, we get so many deaths, we calculate it. And even in India, I try to ask them what is their flu death rate. They cannot. So the idea is, see, you live and die according to the services that you are able to provide and get. So that said, I'm not trying to blame that as a reason, but what I'm trying to say is, just because the dot is not there on that big nice map that comes out of that university does not mean anything. It is what the data that we have to learn. There is a lot of data that is being generated here. And if you don't generate data from third world countries, you're not going to get anything. But then there might be other issues like the microbiome issues. And to tell you the truth, I'm amazed. Every time I went to India, I tried to find C. diff patients. So I go to the hospitals, you see. I have friends who own big hospitals, like literally who own big hospitals, and family or relations who own big hospitals. The idea is, I asked them, where is C. diff cases? They said, we don't have any. I said, what the hell are you talking? They use big guns. There is
Yeah.
ESBLs, there's VRE, there is all the other things, but they don't have C. diff. I just don't get it. So my understanding is, they possibly, their microbiome is different. So so the issue is we cannot blame it on one thing or another, but what we can blame it is trying to understand what we know.
So
And
what you're
what we
saying is
know,
the data that the reasons that you believe uh, decreased immunity in the population of United States is because of the metabolic syndrome, but the same concept cannot be applied everywhere in the world. You have
no,
to
it is
look at
applied everywhere. It is
okay.
applied everywhere in a different scenario. So if you think about metabolic syndrome, like there is high triglycerides, there is low HDL, and there is other things, atherogenic dyslipidemia, that is huge in India.
Yeah,
And I myself have a problem called high LP little a, which most Asians do have it.
yeah,
And that was one of my reasons for going such deep into lipidology. And why is an infectious disease doctor talking about lipidology?
yeah,
I have an issue with LP little a, and there was no treatment until recently. But I don't want the treatment that they are proposing, and I changed my LP little a level by diet itself, and I did it.
lifestyle, lifestyle.
And like the issue just comes down to a lot of stents are being placed in India. A lot of bypasses are being done. Like so much so, they have bypasses like car manufacturing in India, in Karnataka. They're like, you just have them, a guy does like, you
Yeah,
know.
yeah, back to
So
back.
yeah, back to back. So the idea is they have taken it and kind of like they put it on a
Like a factory
manufacturing line.
machine. Yeah, manufacturing line. Yeah,
So the question just comes down to, now that is great, they are doing that, but why can't they take care of prevention? Why
prevention.
can't
Yeah,
we kind of change that atherogenic dyslipidemia? Nobody's doing that. Nobody gives a damn about it. The reason is nobody's evil. I'm not trying to say that somebody's evil out there trying to kill people. No, everybody's doing their thing. Everybody is kind of moving around in their world, doing their thing, and amazingly doing good.
yep,
But what is happening is nobody's stepping back from what they are doing and looking back and saying, what am I doing? Is it really making an impact? Now, they might be making an impact by finding a solution for a new device for stent placement or new guide wire to go certain way or a new drug. But what are you doing to try to take care of preventing that infection or helping solve the problem? And like, don't get me wrong, I have done 72 clinical trials there, and I love every aspect of clinical trials. I go to the clinical trial meetings, and in fact, I'm getting a lot of emails on for this COVID vaccine and different things for me to get involved in. And I will get involved in because that will teach me a lot. Like let me tell you that I love and I'm blessed to be doing what I'm doing. But as I'm doing my sick care, my goal in life is to prevent my own business and be on the well care side and try to prevent this here. If the well care side does good, then I do good. You know,
so
my
you're seeing the merger of COVIDMD with the fruit street concept. Now you're saying, okay, if I improve the health of care through wellness, which is COVID, which is fruit street, I can take care of the crisis of healthcare right there. So that's
the chronic care crisis,
chronic
the
care
chronic
crisis.
the chronic care crisis, which is kind of bugging us really, is I did a YouTube video talk on it. It's almost an hour. If you want to put it on the link of it,
I
it's on
would,
the,
yeah,
it's on a YouTube video. It's a nice thing. I would really want whoever is even
watching, yeah,
listen to this, even if they heard it until now, if they are still there, maybe they would really want to see it because comorbidities. So even like recently there were some people with even aged 100 years or 98 years going out of the hospital. So, see, why would age be a factor in reality when somebody is surviving and walking out of the hospital at 102 or 98 years old? I mean, age is a factor which we kind of blame on. Age is a number, and it just comes down to a complex multifactorial etiology of what are the viral factors, what are the immunological factors, the host factors. And the problem is we are focusing on the viral factors. Now, when the Dr. Fauci or somebody comes out and says, "Oh, in Italy, we found that all these people who are dying because of COVID-19 had a common thing of hypertension," I said, "Wow, okay. Now, how many people in New York died? Oh, they had diabetes or obesity, and the people had coronary artery disease, and people who had these problems have 10% higher mortality." I said, okay, now how can we prevent that? It just takes 3 weeks maximum. And by the way, that California doctor who did the study, Dr. Lustig, Dr. Lustig is amazing. Like sugar, you might want to look up Sugar, the Bitter Truth. I think that was one of the things that will
Okay.
enlighten anybody who is wanting to understand nutrition a little bit. So, and we can do a complete nutrition as to
Ravi, I would love to share with me the name of your YouTube channel. I can look it up
it's
too,
it's
but
it's Ravi Kamepalli.
Ravi
I don't know if
Kamepalli.
I
Okay,
named it anything. It's
I'll look it up and I'll
it's
create
at
a
the
link.
bottom of my it's on the bottom of my website, and basically it's the last video that I posted. And the idea is what he has shown is that it takes only 9 days, and I'm saying it takes 3 weeks. Okay,
And
give me 3 weeks. Give me three
to
weeks.
change the host so the infection can't damage you no matter what.
I mean, like, I'm not saying infection is not going to damage. I mean, but possibly we will optimize your system.
Optimized system. Yep.
So we don't have to kill the economy. We just take the vulnerable people, like people who are in the higher age, say 70 or more, and protect them. And then try to take people who have diabetes, obesity, heart disease, and all that, and reverse them, reverse their metabolic syndrome. Even these 5 criteria of metabolic syndrome I just told you, each one of them, see, we call it a syndrome when we put 3 or 4 symptoms together. And I mean, like, that's when we are ignorant of what the root cause is. Whereas this root cause of all this is insulin resistance. And did you know that it takes 10 years for a diabetic to become diabetic? And during this whole time, they are in a state of insulin fluctuations, up and down and up and down and up and down. And if we don't do fasting insulin levels, I mean, I'm asking you to do me a favor. Maybe from tomorrow on, maybe start ordering fasting insulin levels on your patients. I'll tell you, you will not be the same doctor after this discussion.
Interesting.
If you start ordering fasting insulin, then next time you'll be calling me and asking me what to do next. And I'll tell you, I will freely give you that ideas. No worries.
Thank you very much, Ravi. It's been a remarkable time with you. I think one session, 2 sessions cannot justify your passion and your knowledge, and we have to have you as a regular guest. So thank you for sharing your passion, your wisdom, and I look forward to, coming back to you for more advice.
No problem. I mean, like, I will learn from you, my friend. I don't know a lot about rheumatology. I mean, like,
We'll share our passion that we both share is wellness.
I need to learn a lot about rheumatology, by the way. So
Okay,
that
thank you.
is my weakness.
That's your weakness. No, I'm sure we will find common grounds there. Thank
By
you,
the way,
Ravi.
one question to you at the
Yeah,
last.
yeah.
Why do you want to do it? Why do you want to waste your time on people like me?
So I think that many people have asked this question, and there are two answers that I've given to most people that I'm trying to explore why I'm attracted towards this. Number one, it gives me a sense of a tribe. You know, there is something, I'm reading a book right now, and it's called Leaders Eat Last. And in that part of the book, they talk about the value of a deeper personal connection is much more than a Facebook friends that are there, maybe 800 or 8,000.
That is the why guy. There's the why guy,
Yeah, that's the why, guys. Simon said it. You know,
Simon Sinek. Yeah, I
so
know.
what he's talking about is you have 150 good friends that you have actually a deeper connection. Your life, your tribe will give you so much strength, inner self, the serotonin and oxytocin, that actually is enough. So I am counting those deeper connections that actually change me as a person, because i'm I'm getting that vibe from people like you, uh, not only their wisdom, but also the feeling of strength that I have within my tribe. So it makes me feel complete, whole. And I think that the wisdom that we collectively had around us, we don't tap into that. And I'm
Okay.
tapping into that wisdom
Yeah. I mean,
and
like at the
creating
end
my
of the
own.
day, at the end of the day, even after spending time and talking and all that, execution is what is the key.
Yep.
And it just comes down to us trying to really solve the real problem and trying to empower ourselves and then
And what you
next
have
empower them.
created right behind you, I think if we continue to share that among our medical community, that pathway that you have created, the concept that you have created, it will change how we practice medicine.
Yeah,
So I
because
think, we'll keep bringing you on, keep hammering on to this concept, and eventually we'll start changing mindsets.
thank you. Thank you.
Thank
I
you,
mean,
Ravi.
it is free. It is not even patented. It's not anything.
Yeah,
It,
we'll keep
it's
bringing
free.
you, because the passion that you bring with it is valuable, is priceless.
Thank you very much.
Okay, thank you, Ravi, for your time.